was here at my most vulnerable moment. I came very close to this being the end. These people were here for me.
I chose UCLA because I wanted a strong research institution that had a really wide variety of clinical opportunities, both to work in the county setting as well as in a tertiary care center like Ronald Reagan Hospital.
I was a part of a lab that is beginning a phase 1 clinical trial to conduct gene therapy on patients who have sickle cell disease. I actually have sickle cell trait. My mother has sickle C hemoglobin, and so it pretty personally affects my life and decisions that I'll have to make. It was the reason that I applied to medical school.
One of the most important missions of UCLA Health is to expand their involvement in the community. For UCLA Health to expand into the community and address almost everyday problems and building that trust in the population at large is very important.
The UCLA Health System growth strategy has 3 pillars: to expand geographically, to secure partners and integrate care with those partners, and to deliver value-based care.
Recognizing that we have to grow in all facets of who we are and how we work. We've worked very hard to grow different segments of our health system. We've invested very heavily in growing, for example, ophthalmology. In the recent partnership between Jill Stein and the Doheny Eye Institute is a great example. We have spent an enormous amount of time and energy in ensuring that we're utilizing the Santa Monica assets as optimally as possible and growing those. We have spent an enormous amount of time of addressing our reality that we need to grow ancillary services, including ambulatory surgery centers, and finding partners in those regards. And we can point to very tangible successes in that regard. Folks are concerned about the direction of healthcare in general. And it's important that we treat the Affordable Care Act and the growth and coverage in this community as an enormous opportunity for our health system. And you know, the health system is struggling with this reality that we're full. And how do we address our capacity issues and ensure that we're responsive to the entirety of our communities. If you have the good fortune of being in a place like the Ronald Reagan UCLA Medical Center, you likely have the misfortune of being pretty sick. And ensuring that we're growing our clinical enterprise to address the health needs of those in the community that are medically vulnerable is an inextricable part of the growth plan. It's important for us to recognize that we're doing this also because it's inextricably tied to our economic future. And a lot of what we're doing in the university health system, and UCLA in particular, is predicated on growing the clinical enterprise so that we have the financial wherewithal to maintain the academic and research missions.
UCLA has been a leader in healthcare innovation and healthcare delivery. However, in this rapidly changing market, the thing that pushes us the most is to enhance and maintain our academic mission of research and education, as well as community engagement. Through clinical integration with other health systems and other providers, we will be able to extend to the geographies that we need so as to sustain and maintain our clinical programs, both in terms of population health as well as tertiary and quaternary care that we are known for and we've become, and that basically has made our brand.
The economic reality of today's healthcare environment is creating an enormous amount of partnership opportunities because every health system and every provider in this market is looking for the opportunity to integrate and to look for new partners. And shame on us if we don't capitalize on that. This is a community of enormous duplication. It's in a community of enormous opportunity to do better.